Welcome to our deep dive, you guys, into the world of female reproductive anatomy and health. And this one is specifically for you, our student nurses and faculty, because, let's face it, this is crucial for your future patients.
Yeah, definitely a must know.
We're going to be tackling some intricate details, but I promise you'll walk away feeling way more confident in your understanding. And plus, we'll be busting some common myths along the way.
Ooh, I love myth busting.
Right. Ever heard that those clots in heavy periods are actually clots? Well, get ready to have your mind blown because they're not.
It's amazing how many misconceptions there are surrounding this topic, but having a solid grasp of female reproductive anatomy and health is foundational for providing quality care.
So true.
So let's start with the basics, shall we? The external anatomy, also known as the vulva.
Okay, let's break down the vulva. What are the key structures we need to know?
Well, we have the mons pubis, which is that fatty area over the pubic bone. Then there are the labia majora, the outer folds of skin, and the labia minora, those thinner folds within the labia majora. And, of course, we can't forget the clitoris, which plays a major role in sexual pleasure.
It's interesting how much variation there can be in the appearance of the vulva. It's important to remember that what's considered normal can vary widely.
Absolutely. Every woman's anatomy is unique, and there's no single ideal appearance. Now, within the vulva, we also have the vestibule, which is that area surrounding the openings of the urethra and the vagina.
And tucked away within the vestibule are the Bartholin's glands and Skene's glands. What's their function?
These glands are responsible for producing fluids that lubricate and protect the vulva and vagina. Bartholin's glands in particular can sometimes become blocked or infected, leading to discomfort and pain.
Oh, wow. Yeah, that's a good reminder that even these seemingly small structures can have a big impact on a woman's health. Now let's venture into the internal anatomy. What lies beneath the surface?
We've got the vagina, a muscular canal that connects the external genitalia to the internal organs. It's incredibly elastic, allowing for intercourse and childbirth. Then there's the cervix, which is the lower portion of the uterus that protrudes into the vagina.
And speaking of the cervix, there's this fascinating area called the transformation zone. Can you tell us more about that?
The transformation zone is where two types of cells that line the cervix meet: squamous cells on the outer part of the cervix and columnar cells lining the cervical canal.
So two different types.
Right, and this zone is especially important because it's the most common site for precancerous changes that can develop into cervical cancer.
That makes sense why we focus on the transformation zone during a pap smear.
Now, moving on to the uterus, what should student nurses know about its structure and function?
The uterus is a pear-shaped organ with a muscular wall, and it's responsible for nurturing a fertilized egg during pregnancy. It's divided into three parts: the fundus, which is the top rounded portion, the body, which is the main part, and the cervix, which we've already discussed. And let's not forget about the adnexa, those important structures alongside the uterus.
Right, the adnexa include the fallopian tubes and the ovaries. The fallopian tubes are these delicate pathways that transport eggs from the ovaries to the uterus. And the ovaries, well, they're the powerhouses responsible for producing eggs and hormones like estrogen and progesterone.
I'm fascinated by the ovaries. They're so small, yet they play such a crucial role in a woman's reproductive health and overall well-being. Now, there's another anatomical structure I'd like to highlight: the pelvic floor.
The pelvic floor is truly remarkable. It's a complex network of muscles, ligaments, and tissues that provide support for the pelvic organs, including the bladder, uterus, and rectum.
I've heard that the pelvic floor can weaken over time, leading to issues like incontinence or prolapse.
That's true. Factors like pregnancy, childbirth, aging, and even chronic coughing can put strain on the pelvic floor. Strengthening these muscles through Kegel exercises is important for maintaining pelvic floor health.
It sounds like the pelvic floor is a bit of a hidden hero, quietly doing its job until something goes wrong. Now let's move on to another fascinating topic: the menstrual cycle. It's a complex process that can be quite mysterious even for those of us who experience it every month.
Absolutely. The menstrual cycle is a delicate dance of hormones and physiological changes, all orchestrated to prepare the body for potential pregnancy.
I remember learning about the menstrual cycle in school, but I feel like there's always more to discover. What are some key points that student nurses should understand?
First, it's important to remember that every woman's cycle is unique. The average cycle is about 28 days, but it can range from 21 to 35 days and still be considered normal. The cycle starts with the first day of bleeding, which is considered day 1.
And then the cycle goes through several phases, each with its own hormonal fluctuations and effects on the body.
Exactly. We have the follicular phase where the ovaries are stimulated to develop follicles, each containing an egg. Then there's ovulation, when a mature egg is released from the ovary. After that comes the luteal phase, where the lining of the uterus thickens in preparation for a possible pregnancy. And if pregnancy doesn't occur, the cycle ends with menstruation shedding the uterine lining.
It's remarkable how the body orchestrates all of these changes month after month. And speaking of menstruation, there are a lot of myths and misconceptions surrounding it. For instance, what about those clots we sometimes see in menstrual flow?
You're right, that's a common concern. But those clumps aren't actually blood clots. They're actually made up of endometrial tissue and blood that has thickened, not clotted. It's a perfectly normal part of menstruation, especially for women with heavier flows.
That's a relief to know. Now let's talk about some of the challenges women can experience with their menstrual cycles. Terms like dysmenorrhea and PMS come to mind.
Dysmenorrhea refers to painful periods, often characterized by cramping or aching in the lower abdomen. PMS, or premenstrual syndrome, encompasses a wider range of symptoms, including mood swings, irritability, bloating, and headaches.
And then there's amenorrhea, which is the absence of periods. What causes that?
Amenorrhea can occur for various reasons. It's normal during pregnancy and breastfeeding, and it also marks the onset of menopause. However, it can also signal underlying health issues such as hormonal imbalances, thyroid disorders, or even excessive exercise.
It's important for women to understand what's normal for their bodies and to seek medical advice if they notice any significant changes in their menstrual cycle.
Absolutely. It's all about being in tune with your body and advocating for your own health.
Now let's shift gears a bit and talk about pelvic pain, a common concern that can sometimes be difficult to diagnose.
Pelvic pain can be acute, meaning it comes on suddenly or chronic, lasting for 6 months or more. It's essential for healthcare providers to differentiate between the two because the causes and treatments can vary widely.
What are some red flags that would suggest a more serious cause of pelvic pain?
Severe sudden onset pain, especially if it's accompanied by fever, nausea, or vomiting, always warrants immediate attention. It could indicate conditions like ectopic pregnancy, ovarian torsion, or appendicitis, which require emergency medical care.
Those sound incredibly scary.
They can be, which is why a thorough assessment is crucial. It's also important to rule out ectopic pregnancy first and foremost, especially in women of reproductive age who are experiencing pelvic pain.
So once those life-threatening causes have been ruled out, what are some other common culprits of acute pelvic pain?
Pelvic inflammatory disease, or PID, is a common cause, often stemming from sexually transmitted infections like chlamydia or gonorrhea. Ruptured ovarian cysts can also cause sudden sharp pain. And for women who have recently had an IUD inserted, PID is a possibility that should be considered.
It's amazing how many different conditions can manifest as pelvic pain. It really highlights the importance of careful history taking and a thorough physical exam.
You're absolutely right. Now, when it comes to chronic pelvic pain, it's a different story altogether.
What are some of the most common causes of chronic pelvic pain?
Endometriosis is a frequent culprit. It occurs when tissue similar to the lining of the uterus grows outside the uterus, causing pain and inflammation. We also see adenomyosis, where endometrial tissue grows into the muscular wall of the uterus. And then there are fibroids, which are benign tumors that can develop in the uterus.
It's interesting that so many of these conditions involve the endometrium.
It is. And it's important to remember that chronic pelvic pain can significantly impact a woman's quality of life, affecting her work relationships and overall well-being.
Absolutely. It's not something to be taken lightly. Now, before we move on to the pelvic exam, let's touch on some common vulvovaginal symptoms that women might present with. Discharge and itching are two that come to mind.
Vaginal discharge is normal, but changes in its color consistency or odor can signal an infection. For example, thick white discharge that resembles cottage cheese is often a sign of a yeast infection, whereas thin, grayish-white discharge with a fishy odor might suggest bacterial vaginosis.
And what about itching? What are some possible causes?
Itching can also be caused by a variety of factors, ranging from yeast infections and bacterial vaginosis to sexually transmitted infections and even skin irritations. The key is to ask detailed questions about the characteristics of the discharge and the itching to help narrow down the possible causes.
It sounds like detective work.
It is. We need to gather all the clues to make an accurate diagnosis and ensure the patient receives the appropriate treatment.
This has been such a fascinating exploration of the female reproductive system and some of the challenges women may face, and we're just getting started. In Part 2, we'll delve into the pelvic exam, a crucial aspect of women's health care.
Welcome back to our deep dive. Now let's shift our focus to the pelvic exam, a procedure that can be both informative and, let's face it, a bit anxiety-inducing for both the patient and the provider.
It's definitely a sensitive area, both literally and figuratively.
Yeah.
What are some key things student nurses should keep in mind to make this experience as comfortable and positive as possible for their patients?
The most crucial element is clear and empathetic communication before even beginning the exam. It's vital to explain each step, answer any questions the patient may have, and ensure they feel fully informed and in control.
Right.
Establishing trust and rapport from the outset can make a world of difference.
That makes a lot of sense. Feeling heard and understood can definitely ease anxiety. Now, practically speaking, what about the physical setup? What's the best way to position the patient, and what equipment do we need?
Positioning is key. The lithotomy position, where the patient lies on their back with their feet in stirrups and knees bent, is standard for the pelvic exam. Proper draping is essential to maintain the patient's privacy and dignity throughout the procedure.
Yeah.
In terms of equipment, we'll need a good light source, a speculum lubricant, and tools for collecting specimens like pap smears and cultures.
I remember learning about speculums in class.
Yeah.
So there are different types.
There are. We choose the appropriate size based on the patient's anatomy to minimize discomfort. And here's a little insider tip. Warm water is the preferred lubricant for pelvic exams because gels can interfere with the results of certain tests.
Oh, that's interesting.
Yeah.
That's a great point. It's these seemingly small details that can really impact patient care. Now let's walk through the internal exam itself. What are the key steps involved?
Once the patient is positioned and comfortable, we gently insert the speculum into the vagina to visualize the cervix and vaginal walls. We're looking for anything unusual, such as discharge, bleeding, or lesions. This is also when we pay close attention to the transformation zone on the cervix, as it's a common site for precancerous changes.
That reminds me, can you elaborate a bit more on what actually happens at the cellular level in the transformation zone? I know it's important for cervical cancer screening, but I'd love to understand the science behind it.
Of course. The transformation zone is where two types of cells, squamous and columnar, meet. As hormones fluctuate throughout a woman's life, this zone can shift, making the cells more vulnerable to changes caused by HPV, the human papillomavirus.
Right.
A pap smear collects cells from this area to check for abnormalities that could indicate precancerous or cancerous changes.
It's amazing how much we can learn from just a few cells. Now, after inspecting the cervix and vagina, what comes next?
The next step is the bimanual exam, where we insert two gloved fingers into the vagina and place the other hand on the abdomen.
Oh, okay.
This allows us to feel the size or shape of the uterus and ovaries, checking for any tenderness or masses. It's important to be gentle and mindful of the patient's comfort level throughout this part of the exam.
I can imagine that this part might be a bit more uncomfortable for some women. How can student nurses make this part of the exam as comfortable as possible?
Being attuned to the patient's nonverbal cues is crucial if they seem tense or uncomfortable. We can take a break, reassure them, and adjust our technique to minimize discomfort. Clear communication throughout the exam, letting them know what we're doing and why, can also help put them at ease.
It's all about making the patient feel safe and respected throughout the process. Now, is there ever a situation where a rectovaginal exam is necessary?
Yes, in certain cases, a rectovaginal exam can provide valuable information.
Good.
This involves inserting a gloved finger into the rectum as well as the vagina to assess the rectovaginal septum, the area between the rectum and vagina, and to palpate the pelvic organs from a different angle.
Okay.
It can be helpful in evaluating conditions like endometriosis or pelvic masses that are difficult to assess otherwise.
That makes sense. It sounds like performing a pelvic exam requires not only technical skill, but also a deep understanding of the patient's emotional state. How can student nurses best support their patients emotionally during this potentially intimidating procedure?
Empathy is key. Acknowledge that the pelvic exam can be anxiety-provoking for many women, and create a space where they feel safe expressing any concerns.
Right.
Encourage them to relax and breathe deeply. Talk them through each step and be responsive to their needs throughout the exam.
It sounds like active listening and clear communication are essential tools for creating a more positive and empowering experience for the patient.
Absolutely. We also need to be sensitive to individual preferences. Some patients may prefer a female provider or a chaperone present.
Right.
Honoring these requests is fundamental to providing patient-centered care.
This has been so insightful. The pelvic exam is clearly a crucial component of women's health care, but it's not the only piece of the puzzle. In Part 3, we'll shift gears to discuss important health promotion and counseling topics that student nurses should be familiar with. Welcome back to the deep dive. We've journeyed through the intricacies of female reproductive anatomy, explored the nuances of the menstrual cycle, and delved into the art and sensitivity of the pelvic exam. Now let's turn our attention to some critical health promotion and counseling topics that every student nurse should have in their toolkit.
You're right. Knowledge is power when it comes to women's health. And as future healthcare providers, you'll play a vital role in empowering your patients to make informed decisions and advocate for their own well-being. Let's start with a big one, cervical cancer.
I know cervical cancer is a major concern, but I feel like there is still a lot of misconceptions surrounding it. What are the most important things for student nurses to understand about this disease?
Well, the first thing to know is that cervical cancer is almost always caused by infection with the human papillomavirus, or HPV. Yeah, HPV is incredibly common. Most sexually active people will contract it at some point in their lives.
So how does a common virus like HPV lead to something as serious as cancer?
While most HPV infections clear up on their own, certain types of HPV can persist and cause changes in the cells of the cervix. Over time, these changes can progress to precancerous lesions and, if left untreated, eventually to cervical cancer.
That's why regular screening is so crucial, right? It's about catching those changes early when they're most treatable.
Exactly. The Pap smear is our primary screening tool. It involves collecting cells from the cervix, specifically from the transformation zone we discussed earlier, and examining them under a microscope for any abnormalities.
And I've heard that the HPV vaccine can play a major role in prevention. Can you tell us more about that?
The HPV vaccine is a game changer. It protects against the types of HPV that cause most cervical cancers and some other HPV-related cancers as well. The CDC recommends that all children start the HPV vaccine series at age 11 or 12, but it can be given as early as 9 and up to age 26.
It's amazing to think that we have a vaccine that can potentially prevent cancer. Now, besides the Pap smear and the HPV vaccine, are there other things women can do to lower their risk of cervical cancer?
Absolutely. Lifestyle choices can make a difference. Avoiding smoking, practicing safe sex by using condoms, and limiting the number of sexual partners can all help reduce the risk of HPV infection and cervical cancer.
It's empowering to know that women have options and can take proactive steps to protect their health. Now let's talk about another major life transition for women, menopause.
Menopause is a natural biological process that marks the end of a woman's reproductive years. It's typically diagnosed after a woman has gone 12 consecutive months without a period. The average age of menopause is 51, but it can occur earlier or later.
I know menopause is associated with a decline in estrogen production, and that can lead to some challenging symptoms. What are some of the most common ones?
The most well-known symptom is probably hot flashes, those sudden feelings of intense heat that can be quite uncomfortable. We also see night sweats, vaginal dryness, mood swings, difficulty sleeping, and changes in bone density.
So how can women manage these symptoms and navigate this transition more smoothly?
There are a variety of options ranging from lifestyle modifications to hormone replacement therapy, or HRT.
HRT.
Right? Things like regular exercise, a healthy diet, and stress management techniques can make a big difference. For some women, HRT may be appropriate to relieve moderate to severe symptoms.
I've heard that HRT can be controversial. Are there risks involved?
There are potential risks and benefits associated with HLT, so it's crucial for women to have an open and honest conversation with their healthcare provider to determine if it's the right choice for them.
It sounds like a personalized approach is essential considering each woman's individual needs and health history.
Yeah.
Now, before we wrap up, there's one more topic I want to touch on: ovarian cancer.
Ovarian cancer is often called the silent killer because it often doesn't cause noticeable symptoms in its early stages. That's why awareness and early detection are so important.
Are there any specific symptoms that women should be aware of?
Unfortunately, the symptoms can be vague and easily dismissed, things like abdominal bloating pelvic or abdominal pain changes in bowel habits, feeling full quickly after eating, and frequent urination can be potential warning signs.
Wow.
It's crucial to pay attention to your body and seek medical advice if you experience these symptoms persistently.
That's a powerful message. It's not about being paranoid, but about being attuned to our bodies and knowing when to seek help.
Exactly. And while there's no reliable screening test for ovarian cancer, women with a strong family history of ovarian or breast cancer may benefit from genetic counseling and increased surveillance.
This deep dive has been incredibly informative. I feel like we've covered so much ground today, from anatomy and physiology to the challenges and triumphs women experience throughout their reproductive lives. But most importantly, we've equipped you, our student nurses and faculty, with the knowledge and insights to provide compassionate and informed care to your future patients.
It's been a pleasure sharing this journey with you.
We hope you'll join us again for another deep dive into the fascinating world of healthcare. And as always, remember, knowledge is power.